Cervicitis is a widespread condition that can affect any woman, with studies showing that 30 to 40% of women visiting STI clinics are diagnosed with it. Even more striking, nearly half of all women will experience cervicitis at some point in their lives. Understanding this condition is crucial for every woman to safeguard her health and well-being. In this video, we will talk about this disease, cervicitis, by answering these questions. What is cervicitis? What causes cervicitis? Symptoms of cervicitis. How's it treated? What is cervicitis? Cervicitis is an inflammation of the cervix, the lower, narrow end of the uterus, that opens into the vagina. When the tissue of your cervix is inflamed, it becomes swollen and may bleed more easily. Cervicitis is contagious. You can pass acute, infectious, cervicitis to your sexual partners. You can avoid spreading it by not having sex for at least 7 days after receiving treatment or being completely symptom-free. Cervicitis can have several impacts, including pelvic inflammatory disease, PID. If left untreated, cervicitis can lead to PID, an infection of the female reproductive organs. PID can cause infertility, scarring in the uterus, ovaries, or fallopian tubes, and pelvic pain. Peritonitis. If left untreated, cervicitis can lead to peritonitis, a life-threatening infection. Increased risk of STIs. An untreated cervicitis can increase the risk of getting STIs, including HIV/AIDS. This is because an inflamed cervix can make it easier for viruses and bacteria to enter the body and bloodstream. Painful intercourse. Cervicitis can cause pain during intercourse. Vaginal discharge. Symptoms include a new vaginal discharge, a change in the color of vaginal discharge, or a thick, yellow or green discharge that resembles pus. Types of cervicitis. Cervicitis can be acute or chronic. Acute cervicitis starts suddenly. Sexually transmitted infection, STIs, or other infectious bacteria are the most common causes of it. Symptoms may be more noticeable. Treatment typically involves antibiotics. Chronic cervicitis lasts several months. Symptoms may be more mild or not noticeable at all. It's usually not caused by STIs or infection. Rather, the causes are irritants or allergens in things like feminine products and latex condoms, or from leaving things like cervical caps inside your vagina too long. What causes cervicitis? There are different germs that can cause it. Cervicitis may be caused by a sexually transmitted infection, STI. These include gonorrhea. Chlamydia. About 40% of cervicitis cases are related to chlamydia. Herpes. Trichomoniasis. Cervicitis may be caused by an infection in the vagina, such as bacterial vaginosis. Symptoms of cervicitis. Many women with cervicitis don't have any symptoms. The condition may be discovered only after a routine exam or test. Signs and symptoms, if present, may include grayish or pale yellow vaginal discharge, abnormal vaginal bleeding, such as bleeding after sex or between periods, pain during sex, difficult, painful, or frequent urination, pelvic or abdominal pain or fever, in rare cases. How's it treated? Treatment will depend on your symptoms, age, and general health. It will also depend on how severe the condition is. The goal is to reduce symptoms and prevent the spread of infection. Treatment may include both of these. Antibiotics for you, to kill bacteria or other germs. Antibiotics for your sexual partners, to kill the germs. The antibiotic your provider prescribes depends on the cause of cervicitis. For example, doxycycline 100 mg PO twice daily, BID, for 7 days treats chlamydia. or azithromycin 1G oral, PO, in a single dose. For uncomplicated gonococcal infections of the cervix, the CDC updated their recommendations in August 2012, as follows: ceftriaxone 250 mg administered intramuscularly, IM, in a single dose, plus azithromycin 1G PO in a single dose, preferred, owing to tetracycline resistance, or doxycycline 100 mg PO bid for 7 days. A medication called metronidazole is effective when the cause is due to bacterial vaginosis or trichomoniasis. The recommended dose is 2 GPO in a single dose, or tinidazole 2 GPO in a single dose for T. vaginalis infections. It can take up to 2 weeks for cervicitis to clear up. You should take your antibiotics exactly as prescribed by your healthcare provider to ensure the infection is completely gone. Cervicitis in pregnancy. Cervicitis can be dangerous during pregnancy and can affect the health of both the mother and the baby. If left untreated, cervicitis can lead to premature labor and miscarriage. Stillbirth. Infections in the eyes and lungs of the newborn. Amniotic fluid infection. Postpartum infection in newborns. Pneumonia in the newborn. Eye diseases in the newborn. Do not treat pregnant women with doxycycline, ofloxacin, and levofloxacin. Pregnant women with chlamydial cervicitis may be treated with azithromycin as above or with amoxicillin 500 mg PO 3 times daily, TID, for 7 days. Erythromycin may be an alternative regimen, as follows. Erythromycin base 500 mg PO QID for 7 days, or erythromycin base 250 mg PO QID for 14 days, or erythromycin ethylsuccinate 800 mg PO QID for 7 days, or erythromycin ethylsuccinate 400 mg PO QID for 14 days. Pregnant women with gonococcal cervicitis should undergo the same treatment as non-pregnant women. In those who cannot tolerate a cephalosporin, consider azithromycin 2 GPO. Pregnant women with trichomoniasis can be treated with 2G metronidazole in a single dose at any stage of pregnancy. We hope this article has provided you with valuable insights into the causes and treatment of cervicitis. Remember, staying hydrated and maintaining a healthy lifestyle are crucial for preventing and managing this common condition. For more helpful health tips and information, please visit our HeInfo channel. We encourage you to share your experiences and ask any questions you may have in the comments section below. Your feedback is greatly appreciated.